to test them. So let's do it real quick. So number one is the olfactory nerve, and that's your smelling nerve. So have somebody see if they can smell. Number two would be your optic nerve. That's your seeing nerve. So it's your optic nerve. So you test someone's sight in an eye. Number three is the oculomotor nerve. And so that has several functions, but it helps move the eye inward. So you can see if somebody can turn their eye inward. It also helps with the pupillary reaction and opening the eyelid. The fourth nerve is called the trochlear nerve. It's a very specific nerve. It controls the muscle that moves the eye downward and inward. The fifth nerve is called the trigeminal nerve, and so that controls sensation of your face, and it has a little bit of input into strength in your chewing muscle, but mostly it's testing the sensation in someone's face. Number six is called the abducens nerve, and what that does is that helps turn the eye outward. So have someone look away from the midline, and that's how you test the abducens nerve. Number seven is your facial nerve, so you look for facial symmetry and can they move their face. Number eight is the vestibulocochlear nerve, so that's in charge of our balance and our hearing, so you test the balance and hearing. Number nine is glossopharyngeal, so that's for taste in the posterior third of the tongue. Really is a good way to test that, to see if they can taste in the back of their tongue. It has some sensory function too. Number 10 is the vagus nerve, and the vagus nerve is really in charge of your parasympathetic nervous system. So it controls things like your heart rate, your breathing, your digestion. So that's kind of a hard one to test. Number 11 is the accessory nerve, and it helps control muscles up in your neck and shoulders. So have somebody shrug their shoulders. That's how you test the accessory nerve. And number 12 is the hypoglossal nerve, and that's really in control of most of your tongue movement. So people moving their tongue around and using their tongue to talk, that's how you test the hypoglossal